You could be many other places tonight. Well, actually, probably not if you're sheltering in place, but you could be on another Zoom call or you could be watching TV. So we really appreciate you choosing Lyon-Martin Health Services Virtual Rainbow Celebration. I'm Vitka Eisen. I'm the CEO of Health Right 360, and it is my pleasure to welcome you to the 40th anniversary celebration of Lyon-Martin Health Service Center and the 50th anniversary of Pride. Tonight, we are honoring our history as well as the life and legacy of Phyllis Lyon, who passed away this year on April 9th at the age of 95. Tonight, you'll hear from and meet individuals who are part of the tapestry of Lyon-Martin Health Services. This clinic is a clinic with resilience and a survivor spirit. It has been a healthcare institution for over 40 years and survived as the little clinic that could. Lyon-Martin Health Services has always had initiative, resourcefulness, drive, motivation, but mostly it has had the support of a community that knows and respects its value, why it was created and needed in 1980, and why it is needed even more now as we endure both the COVID-19 pandemic and attacks on healthcare access for LGBTQ people. Tonight, we will also salute and hug close to our hearts the memories of Phyllis Lyon and Del Martin, two lesbian icons who moved the needle further toward the LGBTQ rights we continue to fight for today. I want to welcome our first speaker this evening, Supervisor Rafael Mandelman, representing District 8 on the San Francisco Board of Supervisors, which includes the Castro, Glen Park, Noe Valley, Diamond Heights, and Mission Dolores. Supervisor Mandelman is the only LGBTQ member of the Board of Supervisors. Supervisor Mandelman has been a champion for the LGBTQ plus community during his time on the Board of Supervisors, championing the city's efforts to implement sexual orientation and gender identity data collection, authoring legislation to create the Castro LGBTQ Cultural District, and declaring the Lesbian Gay Freedom Band the official band of San Francisco. As a member of the Budget Committee, Supervisor Mandelman fought for funding in the 2019-2020 budget to support transitional housing for trans youth, LGBTQ senior services, LGBTQ youth programs, residential care facilities, and mental health services for people living with HIV. And he supported $1 million in funding for Our Trans Home SF to provide housing subsidies to 75 transgender and gender nonconforming San Franciscans. In spring of 2020, Supervisor Mandelman worked with Mayor Breed, the Department of Public Health, and community stakeholders to keep Lyon-Martin Health Services open through the COVID-19 pandemic, ensuring the city's most important provider of trans and gender nonconforming affirming healthcare would not close amid a global health emergency. Please welcome our dear friend, Supervisor Rafael Mandelman.
Hey, everybody. Hello, I am Raphael Mandelman, District 8 Supervisor, and thank you, Vitka, and thank you, Health Right 360, for all that you do in San Francisco and throughout California to ensure healthcare for our most vulnerable. It is a tremendous honor for me to be here this evening with you all. Of course, we all wish we were doing this in person, like every other Pride event that's happening. Happily, there are a lot of virtual Pride events for folks to enjoy, and of course, there are plenty of protests going on, and that's absolutely in the spirit of Pride. Whether you're out protesting or sheltering in place, I hope you have a truly wonderful Pride 2020. Phyllis Lyon was my constituent, and I had the honor of getting to know her. Now, by the time I got to know her, she was a sweet little old lady, but of course, she and Del kicked a whole lot of ass during their lifetimes, had really helped transform the world and make the world different for queer people. She lived a long life. It would have been nice for her to live a little bit longer and see the Supreme Court decision that happened last week. That was, I think, very much the result of the work that Del and Phyllis and their generation did, and the groundwork they laid for generations of queer people to come. So with tremendous gratitude to Phyllis Lyon, there was a rally just before shelter in place started to save Lyon-Martin, organized by Lyon-Martin workers, and I'd said at that point that I couldn't possibly allow Lyon-Martin to close because Phyllis was my constituent, and now we absolutely have to keep we must keep Lyon-Martin open to honor the legacy of Del and Phyllis, in addition to all of the incredible healthcare work, one of a kind that Lyon-Martin provides. I do want to thank all the folks who've been involved in working at, supporting Lyon-Martin all these years. It is the little health clinic that could and must continue. And I want to thank HealthRight for providing a home for Lyon-Martin, and to the workers who have insisted that we find a way to keep that clinic going, true to its legacy and the role that it should be playing in San Francisco. The mayor and DPH have come through so far for us, and we're tremendously grateful for that. I think we're going to need to continue to find the resources to keep this this critically needed clinic open through this current pandemic and beyond. But with that, I will wish you all again a wonderful Pride with a lot of love and gratitude for Phyllis and for the Lyon-Martin Health Clinic.
Thank you so much, Supervisor Mandelman. You have been an amazing champion of healthcare services in really the broadest sense, including mental health and substance use disorder treatment for our most vulnerable residents. So thank you forever for our support, for your support. Next, we're going to hear from Dr. Patty Robertson. Dr. Patty Robertson is a professor in the Department of Obstetrics, Gynecology, and Reproductive Services at UCSF. She's been an activist in lesbian health since 1978, when she opened up a research clinic at San Francisco General Hospital to study lesbian women and sexually transmitted diseases. She was a resident physician at the time and worked with Sharon Mills, a nurse practitioner, and Lonnie Schilling, an administrator, to find space, supplies, and staff for this very special evening clinic. It became obvious that there were many lesbian and bisexual women who were medically underserved, and to meet the need, these three women went on to found, it was called at that time, Lyon-Martin Clinic. Please welcome Dr. Patty Robertson.
Thank you so much for that kind introduction. I want to first acknowledge also HealthRight 360 for providing an umbrella for Lyon-Martin, because it's always provided a special environment for patients who are in need of non-judgmental and low cost healthcare in San Francisco. I still occasionally receive letters from women seen 20 years ago through my work at UCSF, thanking me for helping to champion that cause. I also want to acknowledge that Phil and Del always showed up to our fundraising events, and they're my role models. And so I was delighted to be invited tonight, because I want to show up for Lyon-Martin and I want to help continue this vital clinic. I reflected on starting the clinic. I was 28 years old. I was a resident physician working like 120 hours a week. And what were the three strengths that I could rely on to really get this going that I still use today? One was networking, and I was able to convince straight residents to run this 3-month clinic with me, as well as getting supplies from different faculty without any money. We did this without any money. And I did it by asking. And that little note you saw was from Lily Tomlin, who gave one of our first donations. We didn't really want to cash the check. We wanted to keep it, but we did cash it. But that note you saw earlier was from her and Jane when I invited them over to dinner at our house when they were in town for a show, and they turned us down, but they did give tickets to the clinic staff. And adapting. Halfway through the clinic, the supervisor of the women's clinic at San Francisco General Hospital came back from England and was furious when he found out we were using his clinic space in the evening for lesbian health. So we had to go next door to the family planning clinic where there was a more adaptive physician in charge, and we'd have to cover up the family planning sign each time we had a clinic so that lesbians would actually come into the clinic. So from that clinic, we realized that there were so many underserved lesbians in San Francisco, had been in for pap smears, for blood pressure checks, etc. So that's when especially Sharon Mills and Marge Plum showed their leadership in converting this research project into full service clinic. It was a lot of work over the 2 years to finally open the doors to the clinic. So I would just like to also remind us to keep those values strong as the struggle continues to provide healthcare in a very difficult environment. Everyone's struggling right now in terms of recovery in the surge planning that we did economically, and I assume probably you all are doing the same. But we've learned so much about patient care and patients during this time, the power of Zoom to create relationships and decrease overhead, the innovation of peer support groups. And I just hope that we have enough room in our planning to keep what we learned that is positive to help the clinic continue to survive during this critical time. So I just would like to thank all of you for the invitation to speak and reconnect tonight and to embrace your plans. Thank you.
Thank you so much for your pioneering work, Dr. Robertson. Now, I was a frequent user of safety net services in my younger days in San Francisco. So I was once a patient of Lyon-Martin Clinic many, many years ago. So thanks for creating a safe space for lesbian healthcare. Back in those days, I'd go for a medical appointment and the medical provider would always say, method of birth control. And I would say, lesbianism, and they would look at me funny. And it didn't feel very comfortable, but not at Lyon-Martin Clinic. So thank you so much. Lyon-Martin Clinic was and still is a safe space. Thank you very much. So here's what our next speaker has to say about herself. I was born to an Army intelligence officer father and a lesbian civil rights activist mother, and carry on both of their legacies by working for the United States Department of Peacebuilding. My working career ranged from teaching preschoolers to serving senior citizens. I'm married with 2 children, whom Phyllis and Dell called grand adults, and I have 1 grandchild. Kendra is a lifelong activist. As you can see, the apple doesn't fall far from the tree. Please join me in welcoming the daughter of Phyllis and Dell, Kendra Mon.
Hi, I'm glad to be here, and thank you so much to all the previous speakers. I am not a polished speaker, so I'm a little nervous, but I really appreciate this tribute to both Lyon-Martin and Phyllis. Phyllis and I adopted each other a long time ago, and later, much later, we made it legal. And how I first spent time with Phyllis and Dell, it turned out to be their honeymoon week. I was 11 years old, and I spent a week with them. And what I remember most is that Phyllis was shocked to learn that I had never read Winnie the Pooh books. And so each day she would read some of the Winnie the Pooh to me and introduce me to that. As many will attest, Phyllis was fierce as a lion and gentle as a kitten. And she took her last name very seriously. She had cats and lions, pictures and statuettes all over the house. And she was very pleased when Lyon-Martin was named with her name first, because so often it was Martin and Lyon or Dell and Phil. And so Lyon and Martin was a treat for her. She famously said that they were determined to stick out their first year together because of the cat. They couldn't figure out how to divide the cat. And I still say, thank goodness for that cat, because the same determination is what they used to change the world for the better. Among many other things and people that Phyllis and Del introduced me to were Lyon-Martin Health Services, where I joined them at 2 advisory board meetings. And much later, after Del died, Phyllis was having difficulties at home and was diagnosed with dementia at UCSF Memory and Aging Clinic. And much as she was determined to change the world, she was fiercely determined not to change her world and needed no help, thank you very much. But Phyllis's friends, her sister Tricia, my husband, and I knew that we needed help and met a number of times at Lyon-Martin with Doctors Nick Gorton and Dawn Harbotkin. With their help and with the help of UCSF's Dr. DeMay and other staff, we were able to negotiate the many stages of dementia that many of you in the audience know firsthand from your own experiences. They held our hands through interventions about money management to 24-hour care and hospice. And we are eternally grateful to UCSF and Lyon-Martin for their support. And we appreciate this opportunity to share that with you. And thank you for honoring Phyllis and Lyon-Martin today. And it makes it a little easier to let her go. Thank you.
Thank you so much, Kendra. Thank you so much for sharing your story with us tonight. Kendra, you should know that as a once young lesbian in the 1970s, still a lesbian, but no longer young, Phil and Del were absolute lions, and as you said, lions with an I, in the community. Their courage was an inspiration to young people like me, and the days before anything existed like gay-straight alliances in schools. In an age where queer people were shamed and pushed into the shadows, your parents were absolute heroes, so thank you. Our next speaker is another warrior Amazon in the LGBTQ community. Marge Plum is a nonprofit consultant and trainer who focuses on public policy advocacy and organizational and leadership development. She was executive director of Lyon-Martin Health Services from 1989 to 1993, and then swooped in at a time of need to continue providing support, serving as board chair from 2011 through 2014. Currently living in Omaha, Nebraska, Marge served as the director for the statewide Coalition for a Strong Nebraska, a group of over 100 nonprofits working for public policy solutions to end poverty and secure the Title X awards for Nebraskans. Please welcome Marge Plum.
Thank you so much, and to all the previous speakers, and to Kendra, my heart is with you in your very personal loss. When I started at Lyon-Martin Health Services, it was called Lyon-Martin Women's Health Services, and I knew of Del and Phyllis and was quite frankly a little scared because of who they were, and it took me a couple of months before I caught up the urge or the guts to call them to say, hi, I'm the new executive director. And Phyllis, of course, was like, sweetie, it's so nice to hear from you. And Del was like, well, it took you long enough to call. And I never made that mistake again. They took the naming of the clinic very seriously to them. And I worked very hard to keep them up to speed on what was going on. It was a great honor for them to be, for the clinic to be named after them. When I took over, we were in a medical office building on Market Street. We had 2 clinical offices. We had 1 office that was mine, except 1 day a week we were doing HIV testing and counseling. And so I had to leave the clinic because that was the only space for the counselor. So very early we decided we had to get big or go home. And we found a clinic on Market Street and raised more money than any of us knew existed, and built a clinic that was 4 times the size, and had a community space, and really built the clinic up in a way that made us all very, very proud. One little funny story is we didn't have much money, and so we closed on a Friday. We moved everything to the new space over the weekend, and the city, where they were going to give us the final sign off on it. The city inspector was going to come Monday morning. We had clients starting at noon, because like everybody needed services, but the plumber forgot to attach the toilet. So over the weekend, the staff put one of those yellow markers across the door saying fresh floor laying and fresh paint. And so the inspector just walked by it and let us start. I don't know what would have happened if he had gone in to try to flush the toilet. That didn't work for a couple of days. But we were creative. And what happened during that period, though, was also what was happening in the movement. HIV was well known and devastating, the gay male community in particular. And we started seeing HIV positive women at Lyon-Martin. I'll never forget one woman who walked into my office and said that she was, and the HIV clinic at San Francisco General was amazing. And her experience as a lesbian with HIV was one day she went in and told her doctor that she had a yeast infection. And the doctor said, open your mouth, because that was where gay men got yeast infections when they were HIV positive. So we knew we had to start doing something different. So we became just so focused on becoming more diverse. Serving HIV positive women. One point we had about 50, if I recall correctly, doing outreach services to all of the communities in San Francisco, recognizing that identity was not about behavior, and that what Patty and others had started could become a safe haven for everyone who was part of our community. We started serving trans men and women, and our providers just kept keeping up with the changes that were going on. So that part of the Lyon-Martin experience for me, I'll never forget. It's a huge part of my own learning about diversity and how to really make sure that your staff reflect who you serve and that who you serve feels safe. When I came back as board chair, as Vitka said, the board of directors was very close to closing the clinic because they realized there was $1 million deficit from the previous administration, and half of that was to the IRS, which is very serious business. You don't want to owe money to the IRS. And we spent years working with the community and building a community-based board, and talking to everybody we could about what should happen for Lyon-Martin. We had conversations with Vitka, and Health Right 360 opened its arms, paid the debt. I mean, I guess it's not like supposed to be the thing you talk about money, but I have to talk about the fact that they literally paid the $1 million debt that Lyon-Martin owed, and allowed Lyon-Martin to move into their space and to be one of their programs. I know it's tough running health clinics. At the point that we did that, we had about 25 funding sources. We had grants, we had at least a dozen payers. And if you've ever managed healthcare with 25 different funding sources, each paying a different part of a person, it is really, really complicated and really, really hard. So I will forever be in debt to HR 360 and Phyllis and Dell. Those were sad times when I heard that they had passed. and when Phyllis passed, because they were such warriors, and Lyon-Martin meant so much to them through all its growth. And it was, it's actually, it's pretty amazing to have known them and to have had many years of being able to meet with them and sit with them. And I wish everyone in our community could have had that experience, because they were just incredibly special women, really incredibly special. So thank you for inviting me here, Health Right 360. Thank you for everything you've done for Lyon-Martin, and thank you to the city for stepping in. It is hard to keep funding for such a small clinic, which it is in comparison to Kaiser, to UCSF, and it needs the city to take care of it so that it can continue. So thank you to the city officers for being on this as well. Thank you, Vitka.
So much, Marge. You have always come to the aid of Lyon-Martin Health Services whenever asked, and you've been such a strong and stalwart supporter, so thank you so much. Now, our next speaker doesn't need an introduction, but I'm delighted to be the person who gets to do it anyway. People think MLB stands for Major League Baseball, but for me, MLB means only one thing: Mayor London Breed. As a national figure, we are familiar with her compelling story and her dedication to public service, from her work as an executive director of the African American Art and Culture Complex, to her work in the San Francisco Redevelopment Agency as a commissioner, to fire commissioner, to District 5 supervisor, to president of the board, and now to mayor. Watching CNN last Sunday, I was so proud to see our mayor highlighted as one of 4 impactful women on an hour-long special entitled Mayors Who Matter, a town hall on race and COVID-19. And I will always be grateful to the mayor for recognizing before all mayors of major cities in the US that COVID-19 was a serious threat to her beloved city, and courageously ordering the citywide shelter in place. It was a very courageous thing to do, and we are the better for it. So thank you. Please welcome our esteemed mayor, San Francisco's 45th mayor, the elected official who has given the number 45 back its dignity and respect, the Honorable Mayor London Breed.
Thank you so much, Vika, and thank you to everyone for joining us here today to support just an incredible organization. For all the incredible work that Health Right 360 does to support the community and the work you do with Lyon-Martin and what you continue to do to serve this community. I am really excited to be here with all of you virtually today during this unprecedented time as we face a public health crisis, and our LGBT community is still under attack, we know, from sadly a hateful and misguided federal administration. But love wins once again, as we just recently, the Supreme Court and the decision that was ruled that people can't be discriminated against in the workplace based on gender identity or sexual orientation, and that our LGBT community is protected by the 1964 Civil Rights Act. We have come a long way, and we've got to still keep fighting, but this is a huge victory. And the work that you all do to help keep people healthy and safe is so important, especially in light of what we know is happening with COVID-19. And providing professional, competent healthcare workers to lesbian and transgender people, it is really significant. As someone who deserves the utmost care, the utmost treatment, and someone who is there to work to address the challenges that we continue to face. I'm proud that Lyon-Martin and Health Right 360 are stepping up to put an end to discrimination against women, lesbians, and transgender people in our healthcare system. We need more medical providers like you that are providing trained professionals to make sure that they provide the sensitive and safe and compassionate environment so that people who need healthcare, people who need support, and someone who understands the challenges that might exist are there for them to address their healthcare needs. So together, we're helping communities find access to healthcare in this way, and it is truly amazing. And I just want to take also a moment to talk just a little bit about Phyllis and Dell, and to just say how fortunate we are that although they're no longer with us today, what they did, what the path that they set to support the LGBT community, you know, generations will continue to benefit. The opportunities that they have made available, the understanding that they had at a time where this community was not treated fairly, was discriminated against, and didn't get what this community deserved like any other person on this earth. Phyllis and Dale were incredible. They were inspirations. They really opened the doors of opportunity that made it possible for Lyon-Martin and other places like this to exist to support the LGBT community as far as compassionate and competent healthcare. So their legacy lives on through their daughter, through this community, and through this organization. And so during this coronavirus pandemic, we have needed this organization more than ever. And I know that more recently, we had learned of some challenges around the finances of the organization. And the way that I learned about this is I got a call from Supervisor Rafael Mandelman. And Supervisor Mandelman told me about, I guess there was a protest or something going on. And I was like, wait a minute. This is before coronavirus, when we discovered that there were some challenges financially, but you all know the importance of this organization and what they do for people who have a lack of access to healthcare that serves their needs. And so it was not even a question as to if we were going to do something. It was like, what are we going to do and how are we going to make sure that we save this organization? And it was because of the leadership of Supervisor Mandelman that we were able to act quickly to provide the resources necessary to make sure that Lyon-Martin continues. This place is an institution that is necessary and has been instrumental, especially in the support of our transgender community. And I think that what we were able to do is just a small part of what we need to continue to do to make sure that this location is not lost to the community. So this fundraiser today is an opportunity for people to give, to support. We know that the city has a responsibility as well to be a part of the solution, and I, as mayor, am committed to continuing to do all we can to fund Lyon-Martin, to make sure that its legacy and what it was built on continues to serve the community. As we celebrate the 50th anniversary of Pride in San Francisco, so many challenges, so many battles, and here we are still fighting those battles, still fighting the battles of equality for our LGBT community, for our African-American community. But the good news is we're not alone in these fights. The good news is that as an African-American woman in this city, I have never felt the amount of hope and inspiration that I feel at this moment right now for the future of our country, where we should not need a Supreme Court decision to validate what we know about all human beings in this world. I don't care what your sexual orientation is, what your gender is. We should not be discriminated against because of our race or because of who we are or who we love. I am hopeful that we are going to get to that place because we have people like Phyllis and Dale who set the path for us to follow and for us to continue to fight to make sure that the next generation has it a lot better than what we've had to struggle through to get us to this point. I know that I stand on the shoulders of my grandmother and so many civil rights leaders and people who came before me to make it possible for me to serve in this capacity as the first African-American woman mayor. Yes, we still have more work to do, but I'm confident in this new movement at this new time that we're going to get to a better place. So let's make sure that we do everything we can to continue to support Lyon-Martin and Phyllis and Dale's legacy by investing in this organization, by making sure that it has the resources and the support that it needs to continue to remain available and vibrant for the communities that we know need it the most. You have my commitment. I'm happy to be here with you. I am truly indebted, especially to Health Right 360 for the work that they have done over the years to not only support so many folks in my community, but to personally support my sister in her battles over the years. So I'm just grateful that so many people continue to do the work, especially you, Vika. Health Right 360 has been an incredible partner. When we have needed your help with a number of organizations, including Lyon-Martin, the Haight-Ashbury Free Clinic, merging with Walden House, and what you have all done to continue to provide resources to people when they get to a place where they have no one to turn to. You have been there, and we are going to continue to make sure that we are there. This is what making sure that a community is coming together and growing and thriving and really making a difference. You are making the difference. And I'm just proud to be a small part of working with you to make that difference. So congratulations on this incredible work. Supervisor Mandelman and I are here to be as supportive as we can from the city side, even in the midst of the challenges that we face with the budget. There is no question that we have to continue to support the work that you do. So thank you so much for being a part of this organization and making sure that this organization continues to live up to its legacy of the two incredible women for which it is named. Thank you so much.
Oh my goodness, thank you so much, Mayor. You're inspiring. Thank you, that was amazing. I want to thank you for your support of Lyon-Martin Health Services. It's no secret to friends and supporters of Lyon-Martin that over the last 40 years, there have been a lot of times that the clinic has had its share of campaigns and funding drives to keep its doors open and the lights on. And this year was no exception. I want to thank you from the bottom of my heart on behalf of all of our staff and the people we serve and the communities we serve for giving the clinic the breathing room that it needed during the COVID-19 crisis. And I know that we can count on your continued support of the LGBT community and of Lyon-Martin Health Services. So thank you. In 2005, Dr. Nick Gordon approached the medical director of Lyon-Martin Health Services and offered to organize and strengthen Lyon-Martin healthcare services for transgender men and women. Over the past 15 years, with Dr. Gordon's amazing, tireless support, the support of many members of the trans community, Lyon-Martin Health Services evolved into one of the first and one of the leading community health centers providing gender-affirming care for trans and gender non-binary people. Our next speaker is also a pioneer in transgender rights. Cecilia Chung's community service spans nearly 2 decades. As a founding producer of the Trans March, she helped organize one of the world's largest annual transgender events, which has since been replicated in cities across the United States. She became the first deputy director of the Transgender Law Center and is credited with shaping the organization's mission and programs. Mayor Gavin Newsom appointed Commissioner Chung to the Human Rights Commission, where she served for 7 years. Commissioner Chung is the Senior Director of Strategic Initiatives and Evaluation at Transgender Law Center and a Health Commissioner of San Francisco, as well as an internationally recognized civil rights leader who advocates for HIV/AIDS awareness and care, LGBTQ equality, and social justice. Welcome, Commissioner Chung.
Well, thank you for that, that introduction. So that makes me realize that, oh, I must have written that bio last decade. Well, maybe it's not a bad thing to stick with the 20 because then I'm 10 years younger. And thank you again for inviting me to speak. And I'm glad that Vicka, you mentioned Dr. Gordon, and I think that maybe some people didn't even know that Dr. Gordon is also the primary care doctor for Phyllis and Dale. And I think that, you know, that's really speaks to like the spirit of San Francisco. Lyon-Martin is not just a namesake clinic, and Dale and Phyllis are more than giants, you know, like they are more than pioneers. They are the beacon of light, you know, like in the time when, you know, LGBT people were still being criminalized. So this clinic means a lot more than just a clinic. It is, you know, a symbol of what San Francisco stands for, especially in this kind of climate. I still remember when I was on the Human Rights Commission, you know, we we had a panel on lesbitopia, because we are seeing that, you know, like there are fewer and fewer spaces, you know, for lesbian to find their community. And I think that that's continued to be a challenge because a lot of communities have moved to the virtual space. But it is also really important to remember that lesbian, together with Phyllis and Dale, play a huge part in this city's survival of the HIV epidemic. And with all that, I think that it's really important for us to continue to remember that this is a symbol of San Francisco when so many things are getting challenged. Yes, you know, like we have a Supreme Court victories on being protected, LGBT people being protected. But at the same time, we have a hostile administration. They're trying every way they can, you know, to take our rights away, you know, all in the names of religion. And so that was kind of a whiplash because like Friday, we had the 1557 rules, and then Monday, you know, like we had the win, and it was surreal. But that fight is not over because right now there's still a case on reproductive justice sitting in Supreme Court waiting for the decision to be announced. That tells us we still have a lot of work to do, and that tells us why it's important for Phyllis and Del Martin's namesake clinic to continue to shine. It's not just a model. It's a model of San Francisco. It's part of the model of universal healthcare in San Francisco because we seem to have a ways to actually fill every single gap that, you know, the uninsured have in the city. And so I really want to congratulate you on finding the resources in the city coming through to support the clinic. I actually was pretty shocked when I asked, you know, like if we were giving fundings to Lyon-Martin, and the first answer I got back was no. And well, we can't say that anymore. So it is my duty to make sure that LGBT services continue to be defended as, you know, as a health commission, and also, you know, as someone who actually grew with Lyon-Martin. I came here in the 80s, and I've been calling this city home since then. And to really see the change, to really witness how Lyon-Martin transformed from a women's clinic to a clinic that served both women and transgender people. It's really inspiring. I have nothing but admiration for all the people that make it happen. And I have a lot of admirations for the lesbian community who continue to support San Francisco, who continue to show resilience and call San Francisco home in, you know, in this kind of climate. And I hope that, you know, we can do you right and continue to make sure that we have a strong and vibrant community in San Francisco. Thank you.
Thank you, Commissioner Chung, for your 30 years of commitment to serving the LGBTQ community and for your support of Lyon-Martin Health Services. Lyon-Martin Health Services serves on the front line of the community's response to the COVID-19 pandemic, providing specialized medical and behavioral health services to low-income transgender women, lesbian, bisexual, and queer cisgender women, and transgender men of diverse sexual orientations. Our medical and behavioral health services identify and treat those at risk and with symptoms, but that doesn't mean other symptoms that patients have been experiencing have gone away throughout this pandemic. In fact, depression and other behavioral health issues, as well as addiction issues, have only been exacerbated by this crisis. Tonight, as we celebrate 40 years of Lyon-Martin Health Services, 50 years of pride and trailblazing life of Phyllis Lyon, we ask for your support. I hope you will consider making a donation to honor the life of Phyllis and the celebrations by going to www.healthright360.org/donate and making a gift designated to Lyon-Martin Health Services.